You wake up, it's dark. You don't know what time it is yet. But before you even reach for your phone, before your eyes fully open, your mouth is already telling you something is wrong. It's bone dry. Your tongue is stuck. Swallowing feels like dragging sandpaper down your throat. You reach for the water on the nightstand, again, and you tell yourself the same thing you told yourself yesterday morning and the morning before that. It's nothing. It's just getting older. Stop right there, because that sentence has quietly put thousands of men in the hospital. And today, I'm going to show you exactly why. My name is Dr. Gregory Holt. For over 15 years, I have specialized in internal medicine with a focused practice on men's health in the over 60 population. I have seen firsthand what happens when small, dismissible symptoms get waved away. And I have also seen what happens when a man finally decides to take them seriously. What I'm going to walk you through today is not theory. It is clinical reality, backed by peer-reviewed research, built from decades of patient conversations. Before we go any further, and I mean this, everything I share in this video is educational. It is not a substitute for professional medical advice. If you are experiencing dry mouth, fatigue, swallowing difficulty, or any of the symptoms we discussed today, please see a licensed physician. Your health deserves that level of attention. This video is designed to give you the information and the vocabulary to have a better conversation with your doctor, not to replace that conversation. Now, let's talk about what is really going on in your mouth every morning. Point 1. Dry mouth is not a comfort problem. It's a systemic warning signal. Here's what most men over 60 believe about dry mouth. They believe it's annoying. They believe it might be from sleeping with their mouth open, or maybe from that beer they had last night, or just from getting older. They believe it is, fundamentally, a comfort problem. They are wrong. Saliva is one of the most biochemically complex fluids your body produces. We're talking over 700 proteins, enzymes, and antimicrobial compounds working together in a system your body has been perfecting for your entire life. Saliva is not just about chewing. It is your mouth's immune system. It is the first line of defense between the bacteria living in your mouth and the rest of your body. Think of it this way. You know how a city has water treatment, sewage management, a whole infrastructure that keeps disease from spreading? Saliva is that infrastructure for your mouth. The moment that system starts failing, even slightly, even gradually, the downstream consequences start building. Here's the number that stopped me cold the first time I read it. A 2021 study out of the University of California, San Francisco, tracking over 12,000 seniors, found that those with confirmed dry mouth were 2.8 times more likely to be hospitalized for respiratory infection within 24 months. Nearly 3 times the risk, hidden in a symptom most men shrug off before their first cup of coffee. Stay with me, because point 2 is where this gets personal and specific, and where most men recognize themselves for the first time. Point 2. Your medications are probably making it worse, and nobody told you. Let me tell you about a man named Dennis. Dennis was 66 years old, retired machinist, lived outside Pittsburgh, Pennsylvania. Tough guy, the kind of man who had worked with his hands his entire life and was proud that he had never missed a day of work due to illness in 30 years. When Dennis started waking up with a dry mouth so severe, he kept a full glass of water on both sides of the bed, one for his side, one closer to the bathroom for the walk in the night. He mentioned it to his wife, who told him to bring it up with the doctor. He didn't. Because men like Dennis, and I say this with deep respect, because I see it constantly, men like Dennis believe that showing up to a doctor to complain about a dry mouth is not something a man does. 2 years passed. Then his dentist, during a routine checkup, noticed something alarming. Severe dental decay in 5 teeth simultaneously. Cavities so aggressive the dentist asked Dennis directly, "Are you a radiation patient?" Because that level of decay is what she typically saw in men who had received radiation to the head and neck area. Dennis was not a radiation patient. What Dennis was a man on 4 medications, a blood pressure pill, a diuretic, an antihistamine he had been taking for allergies every night for 6 years, and a prostate medication. Every single one of those medications belongs to a class of drugs called anticholinergics, some of the most aggressive suppressors of saliva production in modern pharmacology. Here's what most men, and many doctors, don't realize. When you combine 3 or more of these medications, the salivary suppression effect does not simply add up. It multiplies. A 2023 study from the Journal of the American Dental Association confirmed that 3 xerogenic medications, the clinical term for drugs that suppress saliva, can produce 6, 7, or 8 times the drying effect compared to a single medication. They call it the compounding xerogenic effect, and almost nobody talks about it during a prescription review. Over 500 medications currently available in the United States list dry mouth as a side effect. Blood pressure pills, antidepressants, sleep aids, bladder control drugs, diuretics, antihistamines. If you are currently taking 3 or more medications of any kind, I want you to do one thing right now. Write down every medication you take, prescription and over-the-counter, and look up whether each one lists the words anticholinergic or xerogenic in its profile. Then bring that list to your doctor and use this specific phrase. I would like a formal polypharmacy review focused on my combined anticholinergic burden. Those exact words will change the conversation. As for Dennis, 2 medications were adjusted, 1 was discontinued, and within 8 weeks his dry mouth was measurably reduced. His dentist called it one of the more dramatic salivary recoveries she had seen. He waited 2 years longer than he had to. You don't have to. Keep watching, because point 3 is the one that surprises men the most, and it has to do with your weight. Point 3. Dry mouth is quietly starving you. Even if you're eating every meal, this one lands hard in my office every single time I explain it, because men find it genuinely difficult to believe. You can eat 3 full meals a day, maintain a reasonable appetite, and still be slowly malnourished if your salivary function is significantly impaired. Here is the mechanism. Saliva contains an enzyme called amylase. Amylase begins breaking down carbohydrates the moment food enters your mouth. Simultaneously, saliva sends chemical signals ahead to your stomach, essentially preparing your digestive system. Acid incoming, enzymes ready, start processing. Without adequate saliva, that signal goes quiet. Your stomach is not properly prepared. Nutrients, particularly in men with compromised gut function, which becomes increasingly common after 60, pass through without being fully absorbed. A 2022 Mayo Clinic study found that 44% of seniors diagnosed with unexplained malnutrition had clinically significant dry mouth that had never been identified as a contributing factor. Nearly half. Think about that number the next time someone tells you dry mouth is a comfort issue. The clinical presentation in men tends to be gradual. 1 pound here, 2 pounds there. Clothes fitting slightly differently. Energy dipping in ways that feel like just aging. Muscle mass declining at a rate that physical activity alone doesn't explain. If you have noticed unexplained weight loss in the past 12 months, even modest, even slow, and you wake up with a dry mouth every morning, those 2 facts belong in the same conversation with your physician. Point 4. The 7 warning signals. What your dry mouth is actually telling you this is the section I want you to write down, screenshot, or bookmark. Because these 7 signals are how your body tells you that dry mouth is pointing to something more serious. Signal 1. Ammonia or metallic breath combined with dry mouth. This is a potential kidney function warning. If your morning breath smells chemical rather than simply stale, request a kidney function panel at your next appointment. Signal 2. Thick, ropey, or foamy saliva. This is not the absence of saliva, it is altered saliva. This is an autoimmune signal. Sjogren's syndrome, early lupus, rheumatoid arthritis. Request autoimmune screening. Signal 3. Dry mouth only at night, fine during the day. This is a direct sleep apnea pattern. When your airway partially collapses during sleep, you breathe through your mouth for hours. Your dry mouth is not causing the problem. The problem is causing your dry mouth. Request a sleep study. Signal 4. Dry mouth combined with frequent nighttime urination. 2 trips to the bathroom a night or more, combined with morning dry mouth. This is a diabetes warning pattern. High blood sugar pulls water from every tissue, including your salivary glands, while simultaneously driving up urinary output. Request a fasting glucose and HbA1c test. Do not wait. Signal 5. Dry mouth combined with dry, gritty eyes. This is the hallmark presentation of Sjogren's syndrome, which is dramatically underdiagnosed in men over 60. It is treatable, but if missed, it can progress to involve the kidneys, lungs, and nervous system. Signal 6. Dry mouth combined with leg cramps or foot cramps at night. This combination flags a potentially dangerous electrolyte imbalance, low sodium, potassium, or magnesium. In men who take diuretics, this combination can escalate quickly toward cardiac arrhythmia. Call your doctor this week, not next month. This week. Signal 7. Dry mouth that began within 90 days of starting a new medication. This is your body reaching the clinical threshold of anticholinergic suppression. That 90-day window is not a coincidence. It is a pharmacological timeline. Do not wait for your next scheduled appointment to mention this. Call the office and describe it. Point 5. What you can actually do. 6 steps that work. Let me be direct. Drinking more water will not fix this. Dry mouth is a glandular function problem, not a hydration problem. You cannot water your way out of a broken pump. Small sips throughout the day are helpful for comfort. But if you drink a full glass of water at bedtime to treat dry mouth, you are most likely waking up 3 times a night to urinate and still waking up dry. Step 1. Morning mouth assessment. Before you drink anything tomorrow morning, 60 seconds. Is saliva present? Is it thin and watery or thick and ropey? Is there a chemical smell? Can you swallow comfortably without water? Do this every morning for 2 weeks. You will have more useful clinical data than most men walk into a doctor's office with in a year. Step 2. The medication audit. As I mentioned, write down every medication, prescription, and over-the-counter. Look up anticholinergic and xerogenic for each one. Then ask for a formal polypharmacy review. Use that specific language. Step 3. Electrolytes over plain water. Your salivary glands need sodium, potassium, and bicarbonate to produce saliva. Plain water can actually dilute these further. Small sips throughout the day paired with electrolyte-rich foods, leafy greens, avocado, nuts, bananas, are far more effective than a glass at bedtime. Step 4. Nighttime protection protocol. Elevate the head of your bed 4 to 6 inches using bed risers, not extra pillows, which strain your neck without actually opening the airway. Run a cool mist humidifier at 40 to 60% humidity. And before sleep, use a xylitol-based dry mouth rinse, never alcohol-based. Alcohol-based rinses strip remaining moisture and make the problem significantly worse. Step 5. Saliva stimulation. Xylitol gum after meals. Sugar-free sour candy to activate your parotid glands. Crunchy raw vegetables with at least 1 meal per day. These are clinically supported, inexpensive, and they work. Step 6. The doctor conversation script. Walk into your next appointment and say exactly this. I've been experiencing chronic xerostomia that's affecting my sleep quality, my ability to swallow dry foods, and my energy levels. I'd like to discuss whether my current medications are contributing and request a salivary gland function assessment. Clinical language gets clinical responses. That sentence will change what happens in that appointment. Red flags. When to stop waiting. Call 911 now. Dry mouth with difficulty breathing. Dry mouth with sudden confusion or weakness. Dry mouth with chest pain or rapid heartbeat. Call your doctor today. Dry mouth with white patches inside your mouth. This is oral candidiasis, a fungal infection. Dry mouth with unexplained fever. Dry mouth with sudden dental pain across multiple teeth. Do not sit on these. Do not wait for a scheduled appointment. These combinations are clinical urgencies, not inconveniences. Here's what we covered today fast. 1. Dry mouth is a systemic warning signal, not a comfort issue. 2. Medication combinations silently multiply salivary suppression. Ask for a polypharmacy review. 3. Dry mouth can cause malnutrition even when you're eating normally. 4. There are 7 specific signal combinations that tell you what your dry mouth is pointing to. 5. 6 practical steps, starting tonight, that actually work. And the red flags, know them. Because in the men I've watched, the ones who acted quickly are the ones who are still here telling the story themselves. If you are a man over 60 and you wake up with a dry mouth, I have one ask. Don't let this be the video you watched and forgot. Type "doctor" in the comments right now if you are bringing this to your next appointment. Type "medication" if you are on 3 or more prescriptions and haven't had a polypharmacy review. And share this with one man in your life. A father, a brother, a friend. Because the information you just heard may be exactly what he needs to hear today. If this kind of no-fluff, research-backed content is useful to you, subscribing takes 3 seconds and it means you won't miss what's coming next. I'm Dr. Gregory Holt. Take care of yourself. And take this seriously. I'll see you in the next video.